Hi Benny, my name is Mackenzie and I'm a pharmacy technician, and today I'm going to show you how to use your new inhaler and your new aero chamber.
Okay.
How are you doing today?
Good, how are you?
I'm good, thanks. I understand that you've recently been diagnosed with asthma.
Mm-hmm.
This is a new onset type of thing for you,
Mm-hmm.
and you probably haven't used one of these before, have you?
No.
Do you know anything about inhalers or aero chambers?
No, just like basic things but ready to learn.
Okay, great. So we'll start with the inhaler. So the inhaler is a meter dose inhaler. This is salbutamol, a bronchodilator, and it consists of 3 separate parts. So you have the canister, which includes the medication, and this is metered. So each puff that you release gives you just that amount of medication that's listed on the label here.
Okay.
This lighter blue part is the mouthpiece part, and it holds the chamber at the top.
Okay.
So this is the part where you would put your mouth
Yeah.
if you weren't using a valve holding chamber with it.
Okay.
This is the mouthpiece cover, and this just makes sure that debris or moisture or dust are not getting into the mouthpiece and then traveling into your lungs when you're inhaling the medication.
Okay.
Okay, so the aero chamber that your doctor has recommended is just the mouthpiece aero chamber. So it consists of 3 parts. The mouthpiece, which is this protrusion on this side, and that's the part that you'll create a tight seal around with your lips.
Okay.
The other end has a silicone ring on it, and this is where you'll insert your inhaler. The mouthpiece, you can see, matches the shape on this end. In the middle is the valve holding chamber. There's a valve at this end that prevents the medication from leaving the aero chamber unless you're taking a breath in and pulling the medication through the chamber.
Okay.
Okay? So the first things that you'll want to do every time is to ensure that there's no faults or cracks or defects in either of your devices. Sometimes this can happen in improper storage conditions or transport.
Okay.
So you'll want to just make sure there's no cracks in the silicone on the aero chamber. You'll want to make sure that the valve holding chamber has no cracks or moisture inside of it.
Okay.
And the same for the mouthpiece area. You'll just want to make sure it's in good working order.
Yeah. Okay.
And you'll do the same thing with the inhaler, just ensuring that the mouthpiece cover, and the canister don't have any visible cracks, defects, dents in them that could affect their performance.
Okay.
Does that make sense to you? That part?
Yeah.
Okay. Do you have any questions at this point?
Do I need to use this every time?
Yeah, so it's recommended by your doctor that you use the aero chamber each time you use the inhaler.
Okay.
Just because it can be difficult to get one solid full breath in, especially during an asthma exacerbation.
Okay.
So it's recommended that you use this with each inhalation of your inhaler, and just bring them as like 2 peas in a pod type of situation. Okay, so the next thing that you'll want to do the first time you ever use the inhaler, each time you'll shake it, but this is for the first time. You'll shake it a few times, and you'll release a few test puffs into the air to prime the device. So that's to get everything into the mouthpiece area good. So you'll do 4 or 5 sprays into the air, away from your mouth. Okay. Just into the air. And so you'll do that the first time you use it, and also if you've left it for more than 5 or 6 days without having to use it, you'll want to do that too, just to make sure everything's running through clearly. Does that make sense? Okay. So after you've primed and after you've shaken the device, you're going to you'll remove this before priming it.
Right, yeah.
You'll insert the device into the aero chamber, and it'll create a tight seal in that silicone side. Do you see how it's all tight there?
Yeah.
So the next thing you'll do is take a couple of deep breaths to get your breathing ready. So, and you'll breathe, at the end you'll breathe completely out away from the device. So you want to make sure that you're doing that to ensure that you're not introducing any type of humidity into this area, so that the medication, which is a powder, doesn't stick in this area, and you are ensuring that you get the full dose. Okay. So you'll want to be sitting up straight with your feet flat on the floor, or standing up straight, feet flat on the floor, to make sure that your airway is not obstructed in any way and that the medication can get into this area like it's supposed to. So once you're in a good position and you've breathed out, you'll put the aero chamber and inhaler together up to your mouth level. You'll seal your lips around the aero chamber tightly to make this one kind of cohesive unit into the lung. You'll release 1 inhalation or 1 puff into the valve holding chamber. And take a couple of slow, deep breaths in. You don't want to be too quick. You don't want to be too sharp with it, because you want to make sure that the medication gets into your lungs. It doesn't stick to like the back of your
normal
throat.
deep breath.
Yeah, like a really good normal deep breath.
Okay.
And so you can do a few of those because the medicine's not going anywhere.
Okay.
It's going to stay in this holding chamber until you breathe it in.
Okay.
So make sure that you do a few breaths and get all of the medication into your lungs. And when you're done, you can remove your mouth from the mouthpiece end of the aero chamber.
Okay.
If your instructions say to use a second dose, you'll want to wait, 30 seconds to a minute in between doses to let the first dose sort of settle, and then you'll repeat all of the same steps.
Okay.
Do all of those steps make sense?
Yeah.
Do you understand everything
Yeah.
there? Okay, great. And do you have any questions so far from the steps that we've explained?
No, you explained it great. Thank you.
Okay, that's great. So disassembling the assembly, you'll just remove the inhaler from the end of the aero chamber.
Okay.
If your aero chamber has caps, you'll remove the end cap, or you'll replace the end cap and replace the mouthpiece cap, as well as the cap for your inhaler.
Okay.
And so with these items, you'll want to store them at room temperature, or slightly cooler. You don't want these to be in a hot environment because that can introduce, humidity, or it can cause the pressurized canister to burst or to have deformities. Okay. So just making sure you store them in like a cool, dry place, away from direct heat, away from direct sunlight, type of an idea with that. And in terms of cleaning, you can clean these with, so the aero chamber itself can be cleaned with like a damp cloth with a mild soap. Or it can also be washed in the dishwasher.
Okay.
So just making sure that each of the three parts, so the silicone ring at the bottom and the mouthpiece ring at the top, are all removable. So just open up those components. You can just throw them in the dishwasher, or you can hand wash them with, mild soap and a soft cloth. And just make sure that everything is completely dry before you put it away.
Right. Yeah.
You don't want to assemble
moisture.
any of that to have moisture in it.
Okay.
Right? The same thing goes with the inhaler. You'll just remove the canister and separate the mouthpiece portion from the mouthpiece cap, and these can also be washed with a mild soap and water and allowed to air dry once a week.
Okay.
Do you have any further questions or comments about?
Yeah. Is it right? Like, do I have to wash it once a week, or?
So it's best practice to wash it once a week and kind of make a habit of that, but the most important is just anytime that you see any noticeable like buildup or dirtiness or moisture within either of the devices, you'll want to make sure that you're cleaning it thoroughly, just to reduce anything getting into your lungs, anything that you don't want, and that kind of stuff, and to make sure that the devices work appropriately. Okay, so if it's okay with you, I'd like to schedule some follow-up with you in about a week's time, and somebody from the pharmacy can give you a call just to make sure that everything's going smoothly and you don't have any questions that have arisen afterwards. Is that okay?
Yeah, that's fine.
All right, well, here's your new inhaler,
Thank you.
and here's your new aero chamber,
Thank
and
you.
I hope that they help.
Thank you.
You're welcome. Have a nice day, Benny.
Thank you.